Hello, I'm Dr. Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So I would like to offer my condolences to the family members of another individual who has passed away since I last reported, a resident with Simcoe Manor, a woman in her 80s. I am sorry for your loss. So that takes us to a total of 10 deaths that we've had in that long-term care facility outbreak, and a total of 50 deaths that we've had in Simcoe County, Simcoe Muskoka District Health Unit to date. That means that in the first wave we had a total of 36 deaths, and so far in the second wave we've had 14 deaths. Just to give you a sense of perspective on that particular aspect of the second wave. So as of today, we've had 1,455 cases. This is an increase of 154 cases since I last reported a week ago on October the 27th. And that is the highest number of cases we've ever had in a single week, and it is therefore higher than the number of cases we had the week that preceded, which was 126 cases. Over the weekend, we had 75 new cases, and this is the highest number we've had over a weekend. And in the last 24 hours, we've had an additional 29 cases. If we look at the cases that we've had in the last 24 hours, 25 of them are out in the community as sporadic cases, 3 are institutional cases, and 1 is from an educational setting. 17 of them are males, 12 are females. Their ages range from under 10 to in their 80s. 28 of them are in Simcoe County, and 1 is at this point unknown as to where they live. 3 were from community acquisition, where we don't know how they got their infection. 7 are close contacts of cases. 15 are under investigation. 1 is part of an educational outbreak, and 3 are part of institutional outbreaks. 26 are presently in self-isolation at home. 1 is recovered, and 2 are in institutions recovering. So at this point in time, we have 207 active cases, and we've had a total of 1,192 recovered cases. We have 7 cases in a hospital, so this is up by 2 since I last reported. 1 is in RVH, 2 are in Southlake, 1 is in Headwaters, out of district, 1 is at Georgian Bay General Hospital, and 2, at this point in time, we don't have the actual location on our records, and of course we'll obtain that information. We currently have 13 active outbreaks, up from 5 last week, so that's a substantial increase in the number of outbreaks. 4 of them are in institutions, long-term care facilities or retirement homes, and 3 of them are new in the last week, so I will be getting into the details of them, but they are at Riverwood Senior Living Retirement in Elliston, Granite Ridge Retirement Home in Gravenhurst, and Waterford Retirement in Barrie. We've also had one of our institutional outbreaks declared over in the past week, and that is at Bradford Valley. We continue with 1 group home in outbreak in Simcoe County. We have 4 workplaces in outbreak, which is up from 2 when I reported last. 3 are new in the last week. 2 are in manufacturing and in Barrie, and 1 in a agricultural processing plant. Actually, agricultural setting, not processing plant, in Simcoe County. 1 that had been happening is declared over, a food processing plant in Simcoe County. We have 3 educational institution outbreaks. So 2 of them are in schools. One is secondary school, Bradford District High School, another in an elementary school, Hillcrest Public School in Barrie. And then we have one in a licensed child care center in Simcoe County. And we don't give the names for the outbreaks in child care centers, as they are privately run facilities, unlike the public institutions for which we provide the names. Please be assured that all the individuals involved have been contacted directly and informed of the situation, and those required to be in isolation are in isolation. We have an outbreak in a community setting. So this is a personal service setting, a hair salon in Barrie, and that has involved 2 individuals who are customers and 3 individuals who are staff cases. We've been able to reach all customers who are contacts, as well as other staff members that were contacted or who were contacts, because of the records that they kept with regards to their clientele. And so we notified some 95 individuals in order to determine who would need to be in self-isolation. And we continue to monitor those individuals. So we continue to see in our cases clusters in households, whether they are households that are family members or whether individuals are not related to each other. Formerly, the great majority of these had been in Barrie, but now the new ones that we're seeing are elsewhere in Simcoe County. And we do continue to see, in these instances, multi-generational households that are affected, when it's family members, or if it's households without family members, young individuals who are students or workers. We see connections between those outbreaks and work exposures, or in some instances, work-based outbreaks. And so a really key message for us all would be the importance for employers and employees to maintain their infection control practices, and for people to restrict their social lives to their household only, and otherwise maintain physical distancing and hand washing and self-monitoring, for people to be self-monitoring, and if they have any symptoms, certainly do not go to work, do not go to school. Parents to screen their children before they go to school and withhold them from going to school if they have any symptoms, and to seek assessment and testing. And to use face coverings or masks in indoor public settings or work settings, or in outdoors when you cannot physically distance. All of those things are really critical and play into, I would say, the pattern of what we're seeing of cases. And the other thing I would say is that the majority of our cases are actually occurring not just in Simcoe County, but in the southern portion of Simcoe County and in Barrie. We're definitely seeing the proximity to the Greater Toronto area as a factor here, and in many instances where people work out of district to the south of here, where there's a much higher incidence of cases, that too is a risk factor for the transmission that we're seeing. We're also seeing a shift in the age pattern. So I'd identify that in the first wave, because of the large number of cases in long-term care facilities and the very high incidence of transmission in older people, the average age was in the 50s for our cases. And then as we moved into the summer and into August, and even in September, particularly in September, the average age of our cases dropped by some 20 years. And during the month of September, It was actually 33 years on average. And now in October, because we're seeing cases in long-term care facilities and also older individuals in the community, the age has gone up again. Our average age now is 44 years, so it's gone up by another decade. As we know, people who are older are at a much greater risk of complications, severe manifestation of infection and mortality, hospital admission, ICU admission. So it's certainly of concern to me that we're starting to see quite an increase in the average age of cases. We do also know that increased transmission in the community puts our long-term care facilities at risk. The higher the incidence in the community, the greater likelihood of transmission spilling over and affecting long-term care facilities and resulting in outbreaks. We continue to have exposures in our schools, so we've had 47 instances where individuals who've been cases have been in the school environment affecting 34 schools, and now we have 2 outbreaks in school environments that I've already cited. So that, as I said, is new. Before the last week, we had lots of exposures, but no evidence of transmission, no outbreaks. If we look at our dashboard on our website, you will see that our overall status is still yellow, unchanged from last week. It's broken down into 4 categories. So the category of viral spread and containment remains red as we continue to have an elevation in cases and in our incidence of cases. Laboratory testing is yellow, which is unchanged, and this is all about the turnaround time for our laboratory tests, which remains between 2 to 3 days on average. Our healthcare system capacity remains unchanged at a yellow status because of high occupancy in our hospitals, almost completely unrelated to COVID-19, though I did note that we have had some increase in the actual admission to hospitals related to COVID-19, but most of that is just due to the provision of standard care. The category of public health system capacity has changed to yellow from red, and this is because we've actually had some improvement in our ability to respond to contacts within the required day, 24 hours. So we've increased to 82.7% of our new high-risk contacts being contacted within a day, which was 72.8%, the goal being greater than 90%. We've been able to do this in large part because we've been taking advantage of a service provided by Public Health Ontario and Stats Canada to do contact tracing on our behalf, so that's increased our capacity. But I would say that that's something we need to watch very closely. As cases and contacts goes up, we will become, I think, challenged again on this front. If we look at our trajectory over time, last week our incidence of cases was 23.9 cases per 100,000 population over the week, which is up quite significantly from the week before at 18.7. And compared with the province, we remain now a little bit over half of the provincial rate. The province in the last week being 43.2 cases per 100,000 population over the week, and the week before 41.9 cases per 100,000 population over the week. So we've gone up quite significantly. The province has gone up too. We're going up at this point at a more rapid rate than the province. Our average growth rate is 1.5%, which is up from the previous week of 1.3%. And this is to be compared, this is a daily growth rate. This would be compared with the province's rate of 1.2, which is actually slightly down from 1.3%. So it speaks once again to the fact that at this point we're having a more rapid rise than the province as a whole. Our effective reproduction rate is 1.3, which is up from 1.1 last week, or sorry, 1.0 last week. And as I said before, anything above 1 means that the pandemic is growing here. It's not slowing, it's not declining, it's growing. So we definitely want to get this back down to 1 or less. The province's effective reproductive number right now is 0.9, down from 1.1 when I reported a week ago. Our doubling time, how long it would take for us to double the number of cases that we have, has declined, has decreased. And of course, that means that we're accelerating at this point in terms of the pandemic. So it's down to 47.8 days. So in 47.8 days, if we continued at the rate of cases that we're having now, we would double the number that we would have. So just under, and that's up from last week. Last week it was 59.1 days. So once again, this speaks to us increasing our pace of growth at this time. If I turn to our institutional outbreaks and other outbreaks, they are as follows. We presently have 4 outbreaks, up from 3 from last week. So one is a continuation of Simcoe Manor, and they have some additional cases, unfortunately, over the last few days. We have 1 additional case among staff, so they're up to 29 cases in total, and 2 additional cases among residents, so up to 42. And as I said before, we've had 1 additional death at that facility. As I've pointed out before, there's been a lot of assistance provided in the response to this outbreak, and I would like to commend Simcoe County for providing their additional resources. They are the operator of the facility, and also Stevenson Memorial for resourcing that they provide, and very much would like to thank RVH and commend RVH for providing the management, leadership, additional human resources, including medical resources, physicians, and infectious disease specialists, infection control practitioners, and as I said before, leadership and management resources. So it's very much a collaborative effort, continuing very tight communication and work among the parties involved, and certainly we as a health unit are very much there as well. So testing has been done throughout the facility and repeated, and the next time staff are to be tested again, all of them, will be November the 9th. We have all positive cases in isolation and droplet precaution. We've completed terminal cleaning in the Nottawasaga unit and some common areas of that facility, and otherwise remain with droplet precautions for the residents, and a full application of personal protective equipment for the staff in the response. With regards to our other outbreaks in our institutions, they are as follows. Riverwood Senior Living Retirement Home in Alliston had an outbreak declared on October the 27th, with 1 staff member who is positive. Universal testing being done for staff and residents, and awaiting results for about half of the staff are awaiting the results. The others have come back negative. We have an outbreak at Granite Ridge Retirement Residence in Gravenhurst, declared on October the 27th, with 1 positive staff case and 1 positive resident, and testing being applied to all staff and all residents, control measures in place. And that was declared on October the 21st. And then the Waterford Retirement Residence in Barrie, outbreak declared on November the 2nd, with 1 positive resident. And in that instance, that individual had been kept in isolation, and so had not had contact without any protection for any other individual in that facility. So we maintain control in that facility and are managing it with the usual approach of testing individuals involved and the requirement for personal protective equipment and other control measures. So I mentioned that we have 3 institutional outbreaks as what we categorize as institutional outbreaks to report on. So 2 are in schools. One has one of them is at Bradford District High School with 3 students testing positive involving class that was affected, and all individuals within that class are on isolation and follow-up testing. I should really say that I'd like to extend my condolences to people at that school, because there was a death that took place completely unrelated to COVID-19, but did affect that school. So my condolences to everybody involved. Another outbreak in a school, Hillcrest Public School in Barrie, declared on November the 2nd with 2 students. We've identified all individuals who are contacts in that situation, and they are in home self-isolation and recommendation for follow-up testing. And otherwise, I indicated that the 3rd facility is a child care facility in Barrie, and that was declared on November the 2nd. And as is our usual practice, we do not provide the name of outbreaks in child care centers, given that they're private providers. We stick with public institutions for the provision of such information, or the provision of that information where you've had exposure and we haven't been able to identify all people that we need to contact. In this instance, we've been able to contact all people involved. We have a group home in Simcoe County with an ongoing outbreak. It was declared on October the 17th, so I'd spoken to that before. That involves 6 staff members who are cases. That's up by 1 from when I last reported. All staff members have been sent for testing with negative results otherwise, or results pending in 2 instances. And the residents themselves have not been tested because of their physical condition. We're instead monitoring for symptoms and would manage accordingly depending on the development of symptoms. With regards to community settings with outbreaks, we have a personal service setting, hair salon, and as I'd indicated before, I'd provided some basic information about that. I think I'll go on to other workplace outbreaks. We have 4 workplace outbreaks, up from 2 when I last reported. So one is a manufacturing facility in Simcoe County that was declared on the 21st of October, which I've reported on before. They now have 27 confirmed cases among their staff, up from 23. There have been no exposures to other members of the community. We've otherwise identified all individuals involved. The community has been closed since October the 23rd, awaiting further management of the outbreak and awaiting outcomes of test results. We have another manufacturing facility in Barrie, which was declared as an outbreak on October the 28th, with 3 staff members, testing of all others at the facility, and negative results on the majority of those, and 2 results pending. We have another manufacturing facility in Barrie declared on October the 31st with 4 staff members that are positive, and otherwise all other individuals being tested and monitored. And we have an agricultural facility in Simcoe County declared on October the 29th with 3 staff members, and all other staff members have been tested and the results are negative. I'd also like to say that we had a food processing facility that I'd reported on last week in Simcoe County with a total of 24 cases, which was declared over on November the 2nd. With regards to some key questions that have come up and key matters have come up, we've been advised by the province to emphasize certain key messages for the public, and I think they're excellent key messages, the kinds of key messages I've been giving all along. So they are as follows. First off, that you should stick to your household as contacts, limit your contacts to your households. If you live alone, and adopt another household to be part of, but otherwise limit yourself to your household. And otherwise maintain physical distancing from other people, 2 meters distance, use of mask or face covering in indoor settings, or if you cannot physically distance, outdoors. And people need to be careful about driving together or carpooling. Avoid it if you can. If you cannot, then if there are people outside of your household, you need to be physically distanced if you can. So 1 person in the back, 1 person in the front, both wearing face coverings, having a window open to improve air circulation. They're recommending minimizing trips to public settings. So certainly there are key reasons why people need to go out, like shopping and work, or attending school or physical activity. But otherwise people need to think twice about such things. And the province in the past has also recommended that people avoid travel outside of your community as well, if possible. Screening of your children before they go to school. So make sure that your children use the province's or our screening tool to make sure you're not sending your children to school with any symptoms whatsoever for COVID-19. And same with for yourself with regards to going to work. Screen yourself. If you have any symptoms, do not go to work and seek assessment. Use a face covering in indoor public places or workplaces, especially workplaces if you cannot physically distance, and this is actually by directive from the province. Just a couple of things that I would note. We've got, last week I spoke to our findings about clusters and cases associated with Thanksgiving. So we did an assessment of our data. We enumerated a number of cases and clusters associated with Thanksgiving gatherings. I reported on it verbally. We went back and made sure of our numbers and actually found some more cases. And these cases are actually people out of jurisdiction. So beyond the cases that we have locally, which was a total of 47, which is 14% of all of the cases that we've had since Thanksgiving. We've had a total of 340 cases since Thanksgiving, in the 14 days following Thanksgiving. 47 of them from within Simcoe Muskoka were associated with having gatherings at Thanksgiving. And in all, there were a total of 23 such gatherings. Contacts of up to 16 people associated with these gatherings. But we also noted an additional 15 people from out of jurisdiction. So people who were cases who either came here for such gatherings or people from here who went out of district to somewhere else for such gatherings. So they make an additional 15 cases associated with Thanksgiving gatherings in Simcoe, Muskoka. So that's a total of 63 cases. We're putting our analysis on this up on our website hopefully later today under our health stats page. So please have a look at that. We certainly feel that it's an important message for people. And it is something we're going to be citing going through the holiday season to remind people of the risk of getting together in this way and the importance of limiting yourself to your household and doing physical distancing otherwise and remote communication otherwise. I know it's very difficult and feels very unnatural for people and it's hard on people, and I count myself in that number of people who have difficulty with this, but we see the results of this, and we know that of those cases there are some who were high risk, older people, quite severely affected. So it's something that we need to know about and take to heart and act on. So the Premier today at 1 o'clock announced a new framework for action on COVID-19 throughout the province, a way of determining what protective measures need to be in place in each of the health units based on their disease transmission profile and risk categorization, vulnerability based on impact on local healthcare systems, certainly the incidence of cases and the reproductive number, the kind of data that I cited at the very beginning of my presentation. And I noted that in our own dashboard that we have for ourselves here in Simcoe, Muskoka, we place ourselves at a yellow alert out of a red, yellow, and green framework of our own. So the province now has its own framework with 5 levels: green, which is what they've called prevent; yellow, which is protect; orange, which is restrict; red, which is control; and then something they're calling lockdown, which would be beyond red. So certainly we at Simcoe, Muskoka are going to be monitoring this very closely. I note in that document they've actually indicated that Simcoe, Muskoka would be green, but when I look at the data indicators and apply them to ourselves, in my opinion, we would actually belong in yellow, much like our own dashboard. And I've communicated this to the province already. And I would say that the kinds of control measures that they have in place for yellow, I think would suit us well in Simcoe, Muskoka. I have something very important to announce now, and that is that effective immediately I've issued an order to all of our long-term care facilities, not our retirement homes, but our long-term care facilities, requiring visitation now be restricted to only essential visitors. So every resident can have up to 2 family members identified as essential visitors in order to come in and assist with their care. As is the case in Toronto and Peel and Ottawa, where the province has directed that there be that restriction, by my order, we're now applying that same restriction here in Simcoe, Muskoka. And also I'm prohibiting residents from going on visits off of the premises. It can go for medical appointments, but not for visits. Same restriction as the province has applied in those other municipalities that I've just cited. My reason for this is because we're essentially at a level of 25 cases per 100,000 population per week. And from what I've seen of a review done by the Scientific Advisory Committee for the province, 25 is an action level that's important for the province to consider for decisions such as that. And also I'm very concerned that as the rate goes up, the risk goes up to these facilities, and we've had a significant number of our facilities affected by being in outbreak status. And of course, Simcoe Manor being a very large outbreak with a large number of deaths, I want to strike a balance of protection that also addresses the mental health and quality of life needs of residents. So with this approach, we're increasing protection for these facilities and for the people in these facilities, for the residents and for the staff, while still allowing that kind of critical visitation by key family members so that needs can be met, the needs of these residents. We will monitor this closely and also monitor what the province chooses to do as well, and what other health units choose to do, and certainly monitor our rates of disease here and the overall risk pattern here, and determine whether or not we would need to do anything different. I've already cited that we're not applying this to retirement homes or to group homes. So that's one of the things that we need to monitor really very, very closely. We've at this point chosen to focus on the facilities that are at greatest risk of all, which is the long-term care facilities. We note the importance of people having the flu shot. It's important every year. It's particularly important this year in that we want to avoid influenza activity at the same time as COVID-19 activity. We certainly want to avoid individuals getting both at the same time. As individuals, I'm sure you would want, if you can, to avoid getting influenza, and this is something you can do that makes a real difference. And certainly you would want to avoid having both COVID-19 and influenza at the same time, or the confusion that would arise from having influenza and not knowing without testing whether it's that or whether it's COVID-19. So we do encourage testing, but we also note that there's been a tremendous uptake in vaccination this year, much higher than previous years at this time of year, or perhaps 4 or 5 times the uptake that there had been by this point in the year. And so we're seeing that there's difficulty in pharmacies and family physicians in being able to keep up with the demand. Vaccine continues to come. It comes in installments over time through the month of November. And we hear from communication from the province that they're seeking to get more vaccine in response to the demand. So I would ask people to continue to monitor, look for your opportunity to get your vaccine, and to know that it is coming. To please be assured that the vaccine is coming, and get your vaccination when you can. So some questions from the media. You have 2 educational setting outbreaks, and then only go into detail below about schools by name, what information is available about the other educational setting, and what will be routinely disclosed. So as I'd cited already, I've already mentioned the names of the 2 schools that are in outbreak, and the other is child care center, and otherwise we will not be disclosing further information. Just to reassure you that we've contacted all affected individuals, and that all necessary precautionary measures have been taken for that setting. And I already indicated our approach to that we give information about public institutions, but private institutions, we do not unless it's necessary to do so, because we haven't been able to identify all people exposed. And in this case, we've been able to do that because of their records. A parent of a student at Banting is upset that they were only informed recently via a letter that there was a case at the school, but that the person who has COVID-19 is returning to the school tomorrow. The concern is that the 14-day quarantine isn't being enforced. How is that determined, and why a lag in time until information of cases is shared with parents? So in this instance, what we had was an individual who was a potential case, who was on home in isolation, who did not attend the school until sometime later, they didn't attend the school while they had been symptomatic, and did eventually seek testing. We'd advised testing, they sought testing, but it was some time into their illness, a significant duration of time into their illness before they got their test and got the result back. So by the time we got the result back, it was a relatively short period of time of incubation for the contacts. So we put out the notice so that the contacts would know, and so that they would know that they needed to seek testing, and certainly if they had symptoms to isolate themselves to avoid further spread. There hasn't been to date any evidence of spread in this situation, and of course we're monitoring the situation closely. So because of the timing, it turned out to be a short period of time after the notice that went out that the incubation period was over. And thus that individual who had been, that person's period of communicability had passed and they could return to school. How will our COVID-19 experience drive improvements in the social determinants of health, especially in Muskoka? So this is where our COVID-19 impact survey comes into play. A week ago, I'd identified that we have this survey up on our website where we wish to hear from people in the community about your own experience with COVID-19 and how it's impacted on your life and your well-being and your life circumstances. And all of that is important for us to understand how COVID-19 is impacting on the determinants of health, the basic conditions of people's lives that determine their health. And we've had over 1,000 people respond to that survey, which is an enormous response. We normally expect perhaps 300 responses. So that's really a wonderful response that we've had to that survey. And about 20% of those are from Muskoka. So we've got an excellent response. I would say we're still welcoming more response. We would, in particular, given the profile of what we've received so far, welcome more men responding to the survey, more people of southern Simcoe responding to the survey, people of difficult life circumstances responding to the survey. But so far we've had a very brisk response. We will analyze those responses, that data, and provide a report. We will make that available on our website. I will announce it when it goes up on our website. It can be used by partner agencies or members of the public for advocacy for change. We ourselves could use it for advocacy for change of services or supports. And it can also influence how we provide our own services. So we're hopeful that that will make a difference, and certainly grateful for people's participation in that survey. So at this point, I'd be happy to take questions.
Okay, thank you, Dr. Gardner. Let's start with Chris Simon from the Barrie Advance.
All right, thank you very much. Dr. Gardner, the Child Care Center in Barrie, were there 2 cases linked to that site?
Let me have a look at my notes. We had 3 cases.
Okay. 2 students and a staff member, or?
So, in order to, when we get small numbers, we identify how much information we'll give, and if it's too fine, the granularity of the information, there's the potential to identify individuals, and then we withhold it. So I think I'll withhold response to that question.
Okay, fair enough. And just one more question, if I may. You've got 7 hospitalizations right now. I know you talked earlier about how capacity issues are facing many of the hospitals in the region. But, what level do we need to get to, or what level do we approach before we start worrying about whether or not COVID-19 is going to overwhelm the healthcare system?
That's a good question. I think because of because of the pandemic response unit at RVH, they would have this quite a substantial ability to respond. Perhaps 50 cases would be the capacity that they would have, and that is a resource for the district. So I think what might be more of a challenge is the number of ICU cases and the number of ventilator cases. At this point, I don't have a tangible number for you on that, but I think that's a really worthy question for me to drill down on and give a better answer to in the future.
Thank you.
Thank you, Chris. Erica Engel from Collingwood today. Go ahead, please. Hi, Dr. Gardner. My question relates to the new provincial framework. You said you let the province know you think Simcoe Muskoka should be probably in a yellow zone. How likely is that to happen by the release on Saturday?
I don't know. I mean, at the end of the day, it's their framework as they apply it. It's new too. It's just come out. We'll see what response I get. So at this point, I don't know. And
you mentioned the control measures indicated for yellow would suit Simcoe Muskoka well. Can you expand on which of those control measures you see as being important for the region?
So on my quick read of it, it did speak to some enhancements with regards to seating at restaurants. A reduction to 6 people per table is one of the things that jumped out at me. I think it was taking the names of all the people who attend. So that was just a quick impression that I saw as being something that was reasonable. A reduction in gym class sizes, I believe, was one of the measures. Not an elimination of the classes, but reduction in their sizes, an increase of the spacing between people to, I think it was 3 meters. So those were a couple of key things that jumped out at me. And I should say, I would just note right off the bat, though, that although they jump out at me, we haven't actually seen evidence of transmission in those settings here as yet. They've been issues in other jurisdictions, but we haven't actually seen that yet in our data.
Okay, and one of the controls proposed in yellow for recreation facilities is reducing the number of people indoors to 10. I just wanted to get your thoughts on that as it applies to arenas. Is that something that you'd like to see also indoors in arenas? Because I think it would really impact like hockey and skating programs heading into the winter.
Yeah. I think I would need the opportunity to look at that in more depth, both with my staff, but also with our municipal contacts. I meet with the CAOs of our municipalities weekly, and at times they've expressed concerns about change rooms and how they're used, or maintaining a physical distancing with venues such as curling arenas, that type of thing, or cohorting, people staying in their own groupings and not mixing with other people. So those have been some matters that have been raised to me before and that we've sought to support them on with written communication to help them. But when it comes to these other details, I think I'd like the opportunity to go over those details with those contacts.
Thank you. Thanks, Erica. Jessica Owen from Barrie today. Go ahead, please. Jessica, are you on mute? Okay, we'll come back to you. How about Allison Brownlee from the Muskoka region? Allison, are you on mute? Okay, let's go with James Bowler from Cogeco. Are you there, James?
Sorry, I am actually here. I was on mute.
Okay, I was getting a bit worried about this.
Dr. Gardner, you're talking about, putting the Simcoe Muskoka region in the yellow zone, the potential maybe of going even down with the numbers, but there's a significant difference between Simcoe and Muskoka, with Muskoka having one infection this week and Simcoe having nearly 100. So I'm just wondering if we talked before about this partitioning off. Is this a possibility you could be looking at if you consider moving it into different zones?
I think that's a challenging topic. I see the argument because there is indeed a substantial difference in the incidence of cases in Muskoka versus Simcoe, and in particular South Simcoe. My understanding from my contacts at the province is that so far they've applied their requirements to an entire health unit, and they're still thinking in those terms. I guess I would point out that when they were moving through the stages and opening up at certain points within Windsor-Essex, they actually applied restrictions to sub-areas within Windsor-Essex. So it's not as though they don't have any precedent at all for that approach. But the communication I'm getting at this time is that they're looking to apply it to the entire district. So we shall see, and I've actually communicated to my contacts at the province that sentiment, a desire for some difference between Muskoka versus Simcoe, or the southern portion of Simcoe, but my understanding is that at this point they're thinking in terms of entire health units.
Yeah, just on a related tone, when it comes to making these decisions, I know the Premier has been listening to local mayors and municipalities in terms of shutting those areas down. Is that something you would be doing as well? Is you communicating with the municipal mayors to see their thoughts on moving, to restricted access?
So my main contact with municipalities is through their CAOs, and I meet with them every week, Thursday mornings. It's an excellent, invaluable venue for me, two-way communication, and I will indeed be taking this topic to that venue.
All right, thank you.
You're welcome.
Thanks, James. Let me see. Jessica Owen from Barrie today. Are you on the line? Okay. How about Brett from Barrie 360? Are you here?
Yes, I am. Thank you. Dr. Gardner, I know it's not being specified whether the cases affecting schools are among staff or students, but could you give us a ballpark indication of whether it's predominantly staff or students being affected?
This can be problematic when you get into small numbers and the potential to identify people. What I will say is, in our outbreaks to date, we've not had teachers as cases in the schools. Those two outbreaks.
That actually answers my second question. Thank you very much.
Okay.
Thank you, Brett. Mike Arsavides from CTV. Go ahead, please.
Here's the one guy who's never on with me. Doctor, hello, how are you?
I'm doing okay. How are you?
Good. I got the question now. Did anything in particular spark this decision now to impose the restrictions on the long-term care home? Was it the lack of cases now in the last 2 weeks among residents at Simcoe Manor, all of a sudden getting 2 residents in one day? Or was this just an overall seeing the trend here of cases surge in the community?
So I've been prepared over the last 2 weeks to move on an order, and have been watching closely the case count overall, as well as the outbreaks, the potential for more outbreaks. I've been very concerned because we know that one of the major drivers of outbreaks happening in long-term care is transmission in the community. So I've been prepared for that long. We did have rising cases, very rapidly rising between 3 weeks ago and 2 weeks ago. And then it seemed to level off and go down slightly. So I held off, and now it's taking off again. So my main concern is the trajectory and where it's headed. And certainly the outbreak at Simcoe Manor was of great concern to me. The potential for it, once it gets into a facility, being very big, with serious illness and mortality, is my main concern, and I wish to avoid it at all costs. Well, not at all costs, because one needs to balance the impacts of restriction on visitation. But certainly I wish to avoid it.
And this would be an indefinite move here until we see numbers drop?
Yeah, it's a good question about when we would discontinue. I would want it to be declining again. I would like it to be well below 25 cases per 100,000 population.
If you were to deliver a message to our audience tonight on TV at 6 o'clock, what do you have to say to our audience about right now what is happening in the community and what their level of concern should be compared to what it was maybe 2 weeks ago when we said it was plateauing a bit?
I would say it is most definitely rising, and rising at a rate that's of great concern to me. And that speaks to the fact that there's a high degree of transmission, particularly in southern Simcoe and in Barrie, and that people need to exercise the precautions that I've been saying all along, which is since September, sticking to your household as contacts, and otherwise having physical distancing for everybody else that you encounter, 2 meters distance from people, using a face covering when you're in indoor public spaces and workspaces, hand washing, self-monitoring if you develop any illness, to stay at home and seek assessment and testing. Do the same for your children. We all need to do our part. At the end of the day, all these other restrictions that are put in place are really meant to support those key basic measures of physical distancing, hand hygiene, face coverings, and self-monitoring and isolation. Everything is meant to support that, and if we can together implement all of that, we can gain control of this pandemic again and flatten the curve and bring it back down.
If I can steal Jessica Owen's question, can I ask you here, which point do we move toward possibly closing an entire school? What needs to happen in a school to go from outbreak to full closure, let's say, for 2 weeks?
We would need to see evidence that it's not under control, that we're getting more cases happening that aren't linked to the original case, and would give the appearance that it's widespread, transmitting through the school. So if we get that kind of pattern, then we would be looking to either close a school for a time, or if we can identify a section of the school affected, close that section, that particular grouping of students and teachers. But otherwise, if it appears to be widespread and not coming under control, then we would be closing a school.